When you think of New York and New Jersey as having the highest coronavirus infection rates in the US, it makes sense. They're big states, right? Travel hubs, density, big cities. What about number 3? Guess what it is? California? Seattle? Texas? No, the Navajo Nation.
We flexed into supporting Kayenta Hospital within the Navajo Nation. There have been some very sick people that our teams have taken care of.
In 1 weekend alone, it spread like wildfire. Many battles happening throughout the Navajo Nation against COVID-19. But there's a bigger war here, and that's to slow down, to stop the spread of coronavirus. This bug, this virus, this monster that has come into our homes, come into our communities, and come into our nation.
Where you have high vulnerability of the population, very sick patients. We were able to put teams down into Kayenta Hospital and help providing care in their emergency department, both from a physician and nurse standpoint, but also helping to support their EMS and their ambulances.
So because they're getting such a high call volume, and for some interfacility transports, they're driving 2 hours, that's 2 hours that one crew goes at. We heard one girl, she was on 8 or 9 shifts in a row. But I know that if I'm here, maybe someone else can be at home just resting. If members of the EMS are coming down with symptoms or they need to quarantine, they need to take some time to heal, that really puts a strain because then your other people are working 8 or 9 shifts. That's a lot.
It's really started as soon as I started with Team Rubicon. They've always been safety first. And I knew as soon as I accepted this to be deployed to this area, you have to realize before you say, yes, I will do this, that you accept that you most likely will get this disease. Good to go. So walking up here today, it was more of, I'm resolute, this is something I've decided to do, and I'm gonna go in it with mouth shut, eyes open, and do the very best I can to represent myself, my fire department, and Team Rubicon.
Dealing with staffing is a very stressful thing on a day-to-day basis, but when you look at a situation where 2/3 of their staff were going to be off, that's a huge thing. And so I think that our ability to support their staff, we've been able to take a little bit of weight off their shoulders.
We're all 5-finger beats. And that means that we have the ability to work together in unison and to fight this enemy called COVID-19.